Hi, y'all. Welcome to Cosmopolitans with Lauren. I'm so excited to be back and so excited for the interest that we have with my friend Jeffrey Rosenthal. He is amazing, and we're so lucky to have him on. I've gotten all your questions, and I've gotten them written down right here. So we will be asking those questions of him, and if we run out of time, we could always do a second show. But say hey, Jeffrey.
Hey Lauren, it's so great to be on your show. I most appreciate it. I'm really looking forward to this.
Yes, and then he's this very smart doctor. He knows about a lot of stuff, but I'm fascinated by the way that okay, my lipstick's already coming off, ladies and gentlemen. I'm fascinated by the way he does his plastic surgery, and I just posted it up. And don't give me grief, but he's vacillating into all different areas of plastic surgery and transforming your face without a lot of surgery. So I had to research a lot. So I will get back to that, but I will ask the questions. So Jeffrey, give us a little, should we see Dr. Jeffrey? Just know he's a doctor, people. So Jeffrey, give us a little, tell me a little about yourself before we get started.
So number one, I am a plastic surgeon, but more importantly, I'm an artist. So I sculpt, draw, I do painting, stone, metal, copper, poetry, children's books. I've had shows around the world. And when you work on a face, you have to look at it as a blank canvas that you're really designing, clay that you're molding and sculpting. You have to have the eyes to see it, the visualization to understand the subtle asymmetries, and then the hands from my experience as a surgeon to then create what we want. So my background, it's 12 years of training to be a plastic surgeon. The only training that is comparable are cardiac surgeons and neurosurgeons. And that's because when we're trained to do the entire body. I used to do infants with congenital defects in their back, trauma, 3 hospitals, day and night. Burn patients, I ran the burn unit for the head and neck areas and designed many procedures that I created. And in fact, one of the most embarrassing moments was a young man who was 17 who was in a gasoline fire, and I rebuilt his face and neck. And 10 years later, he invited me to come up to his wedding. And the best man got up first and said, "I want to thank Dr. Rosenthal." And I was like, they're so embarrassed. It was his wedding. But my training is 5 years of general surgery and then 2 more years of plastic surgery. My training program was actually one of the largest private plastic groups in the world. Normally, most programs have 2 or 3 plastic surgeons that work with you. We had 10 and then probably another 20 or 30 that worked with us. And that was probably the only program I wanted to get because some of these individuals are the founders of plastic surgery, and they specialized in various areas of cosmetic reconstruction, all of the above. So that was my background. I was the chief of plastic surgery at Bridgeport Hospital for a number of years. I review textbooks for plastic surgery for the whole country, books that go to 300,000 subscribers, so I keep up to date, and I lecture at many meetings. And last year I actually judged 2 beauty contests, so that was sort of interesting too.
Oh, that would be difficult to go in front of you
That was so hard to do, so hard because
because
these
were
women
you
were.
looking at them like a doctor, or were you looking at them like, wow, she's really pretty? Or were you looking at them, oh, look how much work they've had done? How were you looking
Well,
at them?
no, I was looking at them by their personality and by their cadence and how they moved, how they talked, because in all honesty, a lot of these were representing foundations. And I said to myself, they're not going to go in front of their foundation in a bathing suit. Who cares about that? But how do they speak? Are they really sincere? Or do they have a good voice and a good projection? And in fact, one of the women, she didn't look very good in a bathing suit, but she was brilliant, and just everything about her was amazing.
Mhm.
And we all voted for her. She won.
Oh, she did. Where was she from? Let's just go ahead and ask.
I don't remember if it was from New Jersey. This was 3 or 4 states, and I judged an international one. I've done a few of them, but this particular one I think was from New Jersey, and we she won for it. And it was,
Okay, because I've judged some modeling talent, whatever, at these, when people go away to like New York or whatever, and they're so catty, and I'm just not, y'all know me, I'm not a catty person, so I'll step away. Like I have too much in my past to be catty about somebody else. I mean, somebody could rip me apart. So I found that is, I got kind of turned off on that because it seemed like the judges were really just catty. Like, I can't believe they chose to wear that outfit. But I guess if you're doing it for a foundation, it's probably got some.
well, they represented foundations, but it wasn't for a foundation. These were beauty pageants,
Mhm.
and all of them had backgrounds with foundations, and that were the causes that when they spoke to us. So they speak in front of the judges for 5 or 10 minutes, and we get to ask them questions. And during that question and answer period, that's where you really get to know who they are, their philosophy, and their approach to life. And to me, that was more important than can they walk really well across the stage or do they look great in a bathing suit. Those are irrelevant and very superficial things in
Official
life.
things.
But
All right, I'm gonna ask you, what was your question?
what was my question? Well, it had to do, well, there were, we must have seen 20, 30 women that day, and I would
Oh,
change.
so you didn't have like a
It
certain one.
wasn't, no, I would listen to what they were saying, and then I would ask them, why do you want to do this? What you got involved with it? What is your philosophy? And a lot of these were women that had very bad histories. They were brutalized by people, their husbands, they had alcoholic problems, and they went all beyond this. Some of the international one, I think the woman from South Korea said that she lived in a bunker for 5 years. Another one from India said her mother wouldn't let her go out of the house for 10 years. And all of these women overcame all these atrocities to then stand in front of a group and tell us about them and say, wow, I was able to overcome this. And to me, that's what touched me more than anything else. The other part is superficial. My philosophy, if someone comes to me and they say, make me beautiful, I say to them, I can't make you beautiful unless you're beautiful within. If you have a beautiful heart, I can make you beautiful on the outside. If you don't have a beautiful heart, I'll make you more attractive, but I will never make you beautiful. You can tell a beautiful person by their smile, by their cadence, by how they look and touch you,
And treat other people.
and how you treat someone. If you're kind, considerate, communicative, if you think you're gorgeous, I'm not going to make you gorgeous. I'm not going to make any, I probably won't even work on you because I choose my patients very carefully. I'm very selective in who I've always done this. I choose the patients that I want to work on. It's not just about money. When I work on someone, you get 1,000% of me. You get my energy. I don't stop until I'm happy and pleased. And in fact, when patients, I do procedures in the office, I sit them up and I stare a lot at them and they say, we're waiting for you to smile. When you
Mhm.
smile, we know that's it. It's
Yeah.
beautiful. I said, you're
Yeah.
right. I'm not done until I'm done. That's how I work.
Okay, now I have a lot of what I want to go through before that, but since you touched on a subject I already had written down, um, I know when you said that you worked with the burn pediatrics, okay. Um,
Well, I did burns and pediatric. I
well,
did.
okay, burns
Well,
or whatever. But I'm a survivor of domestic abuse, severe domestic abuse, and I have a lot of scarring over, which I'm not superficially worried about all that stuff. But I have been a go and lecture and talk to people and trying to inspire them that they could move on. I've met a lot of women that have been burn victims from their partners or their husbands that they find that is the way to, no one's ever going to look at them or whatever. Was that ever anything that you were interested in doing? I mean, I know that a lot of the times that's got to be a donational work, but or did
when we Bridgeport Hospital is the only burn unit in Connecticut, and then my training on Long Island, we also had the only burn center, and so I didn't see a lot of domestic abuse that way. There were burns, elderly that fell against heaters. I mean, fires in the home, or that 17-year-old that was at a party where they threw gasoline on a grill and he he was burnt. So I really, and we did a lot of electrical burns where men were up in wires and a wire touched them and burnt segments of his.
That's really hard because I had a friend that's son lost all both his legs just walking in the water. My daughter suffered a severe burn falling out of a golf cart accident. Of course, all the adults got thrown out. She got drugged by the golf cart
Wow.
down a gravel hill, dragging her the entire way, and then land on top of her. So she had first, second, and third degree burns. And the pediatrician was like, "Well, give her some Tylenol." By the end of the night, she thought she saw Satan. I mean, I was calling priest and it was crazy. So anyway, as you said that, okay. So, all right, let's talk about, I love the fact that a lot of women go in and, their big fear is needles and their big fear is they want to have the Botox and stuff like that. We all know people. I've done a lot of stuff on air where we've done a lot of stuff on the surgeries on air from Lauren. It doesn't bother me at all.
Right.
But that don't like needles, that don't like to go under the knife, to get sedated. Now, I find it so fascinating. Tell us about the way you do instead of like a full facelift. How do you, what is different about your facelifts?
So, years ago, 10 or 15 years ago, all we had was surgery. That's all we could do. You would make scars around the ear, which were well hidden. You can lift the face up and tighten it. But that wasn't rejuvenating your face. That was just lifting and tightening. Now, over the past few years, they've come out with bioregenerative products, serums that actually can penetrate into the underlying skin, or we can inject things under the skin that actually target the cells that make your collagen. Those are fibroblasts. The fibroblasts, if we can make them produce more collagen, but we can make them produce better collagen. And there's all types of products that we can now inject under the skin, serums on top of the skin that will do this and regenerate. So who likes needles? I don't like needles. I don't like being stuck with a needle. No one likes that. But the object is, no pain, no gain is not my philosophy. I don't believe in that. The object is to make you as comfortable as I
I'm
can.
coming. Go ahead. I'm sorry.
Did we lose you?
I know I have a back issue after my accident, so I needed a pillow. Okay, go ahead.
Okay.
Okay, okay, go ahead.
But when you do facelift, it's in a surgical center or a hospital. You're either sedated or put to sleep. I used to put all my patients to sleep, which was safer because we give you oxygen. So we know you're getting a lot of oxygen. We control your blood pressure, your heart rate, at least the anesthesiologist does. I would inject your face when you're numb. And so there'd be almost no discomfort during the case. And afterwards, my patients had no pain. Even noses that I do a lot of, there's no pain. And patients will come to me and say, well, all my friends had noses, they had pain after this. Absolutely not. Because if you're gentle with the tissues and what you take apart inside, you put back together, you splint it internally, and then you splint it on the outside. Like when you break your arm, it hurts like heck. Put a splint on, it doesn't hurt. So you have to think about all the things you can do to make someone comfortable, whether it's injections during, afterwards, splinting, whatever you're going to do. So we've revolutionized what we can do now with the face. We can use a neuromodulator, which is like a Botox or a Xeomin, and they all work in order to prevent the muscle from contracting and forming those lines and wrinkles, like an accordion. You go back and forth, and you get a lot of ridges. And the other thing that happens is that our skin ages, so you're losing thickness of collagen, you're losing the elasticity in our skin, and you're losing fat, bone, and muscle in the face. So the aging, we've learned that you just don't do the superficial treatments from aging, but you have to address all the layers that change in our face. Back to the bone. So the bone loss is significant. Women lose more bone than men because they start out with much less bone, but they're losing bone in this arch in the malar bone over here. They're losing a lot of bone in the chin and the back of the jaw, which shrinks down, and then the muscles that go over it aren't supported. We're losing bone in this area of the maxilla, and as this goes, this shrinks in, the lip becomes longer, and everyone thinks your nose grows. It doesn't grow, but without support of the bone, the nose drops down, and it becomes wider because you're losing bone in those areas as well. So you're getting a lot of bone loss in the forehead, the beautiful angles and the contours are lost. And then in our face, we have two major layers of fat. We have a deep layer and a superficial layer. The deep layer is to support the muscles that can glide over the bone. The superficial layer gives you more of the contour. And if you're losing both of those, we're losing fat in the cheek area. The fat is now descending that we have, and it's going along the jawline as well. And we're gaining some fat along these nasal labial folds. And because of that, sometimes you see hollows in the rim over here because the fat is descended. And so you have to address the areas of fat loss. You have to build up the bone. You have to regenerate the skin so it looks healthier because skin, let's face it, is the sexiest organ. It's also the largest organ. If you
Mhm.
have nice looking skin, you look great. If you have terrible looking skin, I can make you look good, but you don't look too hot. And
Yeah.
so we have to make you have lovely, luxurious, clean, healthy skin, fat pockets that are now regenerated. But we can't regenerate the fat, but we have fillers. And the fillers that we have now are incredible. One of them is a calcium based filler called Radius, and that's placed along the bone itself. And that's to give volume and shape to lift it. Think of a pillar. Pillars are calcium. So we're building up the areas we've lost the bone here and along the jaw. And that's, think of that as the cake. So the cake that you're making is sort of uneven. So on top of that, we're going to put the icing, and the icing are different hyaluronic acids, which are products found in our skin. They're in our joints, in our skin, all over our body. And we lose those products as we age. And so I'm through with a blunt needle, and it's not sharp. I'm filling these areas with a cannula, that's what it's called, to sculpt your face. And then what I do, I will sit you up, and then I will actually physically mold it with my hands, lie you down, put some more in, draw another map on your face where I want to improve the contour and do it again. So our faces should have a gentle undulating curve. We shouldn't have a big indentation and then a bulge. So you think of beauty as reflecting light off the cheek and capturing light below the cheek. So areas that reflect and capture, that's what's going to make a face very pretty, just like a painting. Artists paint to capture light and reflect light. That's what you're seeing. And when you look at a painting and you stand back from it, you say, wow, that's gorgeous. When I go to a museum, I go up 1 foot away and I look at brushstrokes. I love to see how things are made. I want to see them built up. When I look at a face, it's the same way. I look at dimensions that are millimeters different. That's how my eye is. It catches subtleties of the contour in the face, and then I have to contour it to make it balanced, but never symmetrical. Faces are not symmetrical. If you take both right sides, a right side, and put it with the right side of your face, it won't look
Yeah.
like you.
Mine are so different.
Everyone is. One orbit is lower, and that's because the facial structure, the bone, as we grow, we don't grow outward like this, but we're fused. And when we fuse, we don't fuse evenly. And so one orbit's a little lower, one cheekbone's lower, one jawline is lower, and the side that's lower will have more fat hanging. Imagine a clothesline that's sort of drooping and hanging. Well, the clothesline on that one is going to hang more. So your jowl is going to be thicker. Your jaw, the fat in your cheek here will be lower. And all those things have to be addressed to make you balanced and harmonious. That's the key. Harmony of all the features, your eyes, your nose, your lips. Having big lips that make you look like a fish, I don't believe in that.
Oh my gosh, I
That's
just
just not my
watched
look. I
90
don't, I
Day
don't like that at
Fiance.
all.
I just watched 90 Day Fiance and what's the oh my God. All right, I
Yeah,
wanted to
not a
set
good look.
like my friend Jennifer Aniston. Um, um she has deep but she's always but since she's been a friend when she was young she's like me, which I have these. I think it's because we smile a lot, like I smile all the time, so I have these now. That's never bothered her. I know a lot of people get these filled. I'm gonna tell a funny story so people beware that you use the right person. So I had mine filled, which with the person, this is when they first came out, and I was married to a doctor, and he was like, "Oh, get her to go do it." So we had it, and I'm sitting at home, and you just see these strings. It looked like silly string. It was string like underneath here, sticking out. It was blue, flipped out. I got my daughter on top of me and she's squeezing that gel out of my body. I mean, we spent, I don't know how much money. She squeezed all of it out. It went back to being normal. So my fear has always been to have anything done here because of my horror of that thing. Is this some, I mean, I know a lot of women don't like that. To me, it's
Yeah.
natural. I like, I don't want to be a like that, but is this something that people can fix? Because I know a lot of my friends have real issues with this.
So think of many years ago, I came across a magazine article and it said facelift. And I said, well, that's funny in this magazine, a facelift. And they were talking about a house facelift.
Uh,
You know what? It's exactly like the face. You have to have a foundation, and upon the foundation, then you build the walls, then you build the ceiling, and then you paint it. And you do all those things. So there's different areas. So you don't fill these lines first. You have those because there's no cheek fat, and everything droops down, and then the skin that doesn't have support folds over this line that doesn't move. It's like a roadblock. And this gets deeper because you're losing bone mass here. So if you contour the cheeks first, if you put a fillers here to give a nice sweep, not a round ball, and the peak of the cheek, and I see this with women walking around, a big bulge here. I said,
it looks so
how
fake.
do
I
you do
can't
that?
stand.
That's not the peak of the cheek. The peak of the cheek is here. So
Looks like a Lego person.
it's a gentle sweep up to fill the arch, balance this. And once you've done that, then you go and you can fill this across it, up and down in different layers in order to subtly contour it. But you're not supposed to put so much in that you have a finger of a lump sticking out of your face. The other areas that we lose fat is right over here. Is a depression right here next to the muscles, and you can gently fill that and fill the jawline and actually improve the chin a little bit. So the chin and the nose are in line. The chin in a woman is not supposed to be above this line because it looks masculine. So the aesthetics for male and female are totally different. When you do a male, you don't want to feminize them. And when you do a female, you don't want to masculinize it. So you have to understand the anatomy and the structure and what you're trying to achieve. And the other key is you want to always maintain their identity. You don't want to change it. Whether I do nose surgery or surgical facelift or anything I do, it's got to look natural. I want to maintain their identity, and that's much harder than to just throw something in. So when I do fillers, it could take me an hour and a half to do them for the cheeks alone and balance it. If I'm doing other procedures like the endolift, which we'll talk about later, which is a optical fiber that goes actually under the skin. It's a laser, but instead of bombarding the outer skin and burning it off, this targets the fibroblasts, stimulates them, tightens your face, and also liquefies fat. And so those areas you want to not take off too much fat. You have to know exactly what you're doing. Just like the threads that I will put in, they're called PDO threads, which is polydioxanone. There are threads that are very compatible with the human body, and they're all put in through little pinstick holes. And I can lift and contour the face and the jaw and the neck. So I often do multiple procedures at the same time because there's not one procedure that will rejuvenate you, but multiple. Now, I don't have to do them all at once either. I saw a woman today. I said, look, we're going to start with this, and then I'll see you back in 6 weeks and we'll do some more filler. And if you need something else, we'll do that. And if you don't need it, we won't do it. But why do something that you don't need? So let's do it slowly. Let's build you up the right way. Let's not rush. All of these procedures within a few days, you look fine. Even with the endolift and the threads, within a week, I mean, you can be out and no one would know you had anything done.
So you're not going into the hospital to go under procedure.
Oh
You're
no,
doing it.
these are all done in my office.
Mhm.
Very comfortable table, music playing. I do everything in my office. I actually don't have a nurse in my office. And I learned to do that because of all my trauma and burns that I used to do. I would spend 8 hours rebuilding a burn, and then I wouldn't let anyone touch my bandages or dressings. I'd have to do it myself. And even in the operating room today, I bring 60, 70 of my instruments, and I can't say to the person, hand me a scissor, because I have 40 scissors. So I just take it all. So I'm used to doing it all myself, and I'm very comfortable doing that. So in my office, it's my staff in the front, me, and everyone is very comfortable. And during the procedure, I will say to you, I'm going to ask you how you are, and you're going to get so bored with this because I'm going to ask you so many times. And and they say, "Oh, good, that's great," because I want you to be comfortable. And because I have a very low rumbling voice, I actually almost put them to sleep. It's like, and when I did a lot of children in my day, a long time ago, I would tell them it's not going to hurt. We're fine. And the mothers would come in and say, "How did you put my child to sleep?" I said, "They get bored with my voice." I would say, the whole
Mhm.
hour I'm saying it's fine. And they would just fall asleep. They said, "Can we hire you as a babysitter?"
No, babysit. Yeah, yeah, yeah. Come in. But I mean, do you get I know, like I said, I was watching 90 Day Fiance, and the women that just can't stop, like the cat lady, you've read about the cat lady and like
Yes.
Michael Jackson and women that just can't stop. I mean, because I'm wondering who are the doctors that are doing this? Like who is it?
That's the key. It's the patient can request something, but if the nurse or the doctor or who's ever doing these procedures on them doesn't have the ethics and the morals to say, you know what, this is enough, we're not going to do it. I used to have a woman that would come, I would do her lips, and she would come back in 5 months. Can I do more? I said, no, no, I'm not going to do more. You're gonna, I'll see you in 6 more months. She'd come back in 4 months. Can I? No, come back. And then we kept doing this. So my agreement with my patients are, you come in, you will tell me what bothers you. It's not what bothers me. It's what's bothering you about your face. And then I will say what I can do to correct this or what ancillary procedures you might not be aware of. And then we have to be on the same page. I have to say, this is what I'm going to do. And you're going to say, good. If you say you want something I won't do, that I don't think is appropriate, I will not do it. And the other way around, you have to understand what I'm going to do. And if you're not realistic, in all honesty, I don't work on you. I've turned away many patients in my career saying, look, you have to listen to me. You're going to get a lot of instructions from me. I'm going to go over them. You're going to see me often. I'm going to call you at night to make sure you're okay. And you have to be able to follow these guidelines to get the best results. I've been doing this a long time, and I've delineated all the things that will make you heal faster and give you optimal results. It's not just my procedure, but you have to, sleep in a position, keep down the swelling, all the things that I've worked on and thought about for years is what I'm going to give you. And that's how you get good results. So the women that look like a cat woman or they look like they're deformed, and Hollywood women have so much money, these actors, and some of them look so terrible. And I'm just, it boggles my mind. Who do they go to? That
Yeah,
number one,
well,
it's just,
like I told you the story about Priscilla Presley, who has
yeah,
all the money in the world, that
yeah.
had tire gel put in her face just because she went to a Botox party at a friend's house, and she stuck that way. And so I guess my question to you, I have written on here, are you trying to help women look younger? Or are you trying to help them age gracefully?
So, you can have a woman that's very young, not look very attractive. I have a 92-year-old woman who's still singing. She was with Frank Sinatra and Marilyn Monroe. And I'm
Oh,
telling you,
wow.
if you
I
saw her
may have to
come,
get her name.
if you saw her, she comes in with stiletto heels, Italian clothing off. Her hair is trimmed short. She's got her 96-year-old boyfriend with her in tow, who also looks amazing. And it's not an age, it's looking well for every age. And so
Mhm.
it should be a nondescript age. When someone looks at you, they shouldn't say, oh, you look well for 35 or
For that age,
45
yeah,
or
yeah.
60. No, it's like, how old are you? You look great. When I do surgery, my biggest compliment is that everyone will say, "You look well. What happened?"
What have you done? Yeah, what have you
I had
done?
one woman who is on the board of this big company, and I did her eyelids, and she hadn't been there for a few months because she was healing, and she went to the first board meeting, and this is years ago, and we couldn't do this now. CEO stopped the meeting in the middle and said, "You look really well. What'd you do?" And she said, "No, no, nothing." 10 minutes later, stopped it again. Finally, she said, "I changed my makeup." And he said, "Okay, fine. You look really well." But that's who it's all supposed to be. Fillers, thread, anything I do is supposed to look natural. You're not supposed to look like it's overdone or underdone. It's supposed to be fitting your face, make you look rejuvenated, refreshed, and attractive. That's the
Mhm.
key. And then if you add a smile to it and a kind heart, man, there's nothing
It's
better
nothing
than
to-
that.
All right, now the big question, dun 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 dun, because I know that you fly all over the place to treat women in Europe, and that's why I called you, international star plastic surgeon. Um, Unfortunately, for people that want to look good, they don't have the money. So,
Right.
do you run a what is it called? I can't think of it. Wait,
Clinic, a
a,
clinic.
a clinic or where they can pay you a certain amount of money per month. I can't think of the billing. I don't know why my brain just got a hiccup. I guess thinking about billing just threw me out.
Mhm.
But I mean, because it sounds like you're going to be a class ahead about like the most person that can like run to. I keep getting some message from New Jersey as aesthetics. I'm like, who has my name to keep giving them this? So first, how are your patients finding you, and do they need to sell one of their houses to get the work done?
No, they just need to sell their car.
Or their child? Which one?
And that's it. Oh, their first child, maybe the second child.
Okay.
It's like less valuable.
Rumpelstiltskin.
It's okay. First child, no, keep. Second child,
Okay. Yeah, the first child's like a pancake. The first
yeah,
pancake always
right.
comes
Then
out
the second
bad.
one, no, I already had. And the third one, forget you can just take.
Okay.
Good
So,
stuff. How do they find me? A lot of it is word of mouth. My patients, like me, they talk to their friends, they write reviews for me. I know Google is, people look at it. That's one means, but you can get anyone to write a good review for Google for you nowadays. And so it's more word of mouth. They also look at my Instagram, my Facebook. I post my photos, real photos of my patients that aren't doctored up. You can
mhm,
see my work. They go on my website, Jeffrey Rosenthal, MD, and they can see before and afters of all the procedures that I do. I recently rewrote the entire website. So what's on there is legitimate. It wasn't written by some PR person. It tells about how things are done. Likewise, when your office, you get brochures that I've written, so that tells you about it. I look at everything we do as upkeep. So if you said, I'm never going to wash my face again, I'm going to save money on soap, I'm never going to get another pair of clothing, that's ridiculous. And
mhm,
so, what we do is upkeep. And yes, what you're going to pay for me will be a little bit more, but you have to understand I'm going to take 3 times more time. So if you go
mhm,
to a med spa and they see 5 or 10 people in an hour, and I see one every 2 hours, and they charge a few $100s less, who's making more money? But I don't
mhm.
work for the money. I work for
You're a creative person. I can,
this is
you know.
this is art for me. When I
Mhm,
work on a face, it's got to be as pleasing for my patient and actually more pleasing for me because I know what I can achieve. And I
mhm,
work super hard. And the patients that get the best results are the ones that come in that I know. And they say, okay, we trust you. Just do what you got to do. And they say,
mhm,
oh, we know you do a great job. You've done it before. Just, yes, money's important. And I never overdo. So I'm not
mhm,
going to put extra in your face. I'm not going to do extra anything on you to make more money. I'm going to do the amount that I think is appropriate for you. And if you
mhm,
need a little bit more, I will sit you up and I'll say, look, you've aged more, you've lost more fat. I think we need a little bit more here. You want to wait? We can do it in a few weeks. It's up to you, or we could do it
mhm,
all now. And invariably, they say, look, we're here. You've already made me numb, and just do it. All the fillers that I use have a numbing medicine in it. And it's
mhm,
when I do threads or other procedures, I will put a numbing material under the skin. So invariably, almost everything I do is fairly painless. On a scale of 1 to 10, when I do the deeper procedures like threads or endolip, you may have a 1 or 2 for the whole procedure. Occasionally, you may have a 5 for like a second or two. And that's because you're going through scar tissue. Everyone
mhm,
has scar tissue under the skin. They say, well, I have scar tissue? Of course. Sun damage, pollution, smoking, diet, all of these, any fillers that you've ever had in your face is going to cause a degree of scarring. And I have to then compensate for that going through the scar and balancing it. And so you may feel something for a moment, but it's
mhm.
very transient. I've done friends and they're friends of mine. So like, does this hurt? And they say, no, it's like almost nothing. And if it
Hmm.
does hurt, I inject it, make it a little number. Again,
Hmm.
it's supposed to be a comfortable procedure. If my patients had pain, they wouldn't come back to me. They're not coming back to me. I wouldn't go back to the doctor. If every time I went to someone, he said, wow, this hurts like heck, I wouldn't do. I went years ago. I was going to a guy for a shiatsu massage, and he
Oh,
was
I
from China.
love those.
Well, not this. He was from China, and the guy was 5 foot wide by 5 foot tall,
Uh,
and he had me on a table. He brutalized me so much. I was like tearing the table apart. And
mhm.
the woman who spoke Chinese, I said, "Does he do that to everyone?" And he laughed. He said, "No, just one other prize fighter." I said, and I never went back. It was like
Uh-huh.
torture. So
Uh-huh.
they're not going to come to me if it's torture. It's supposed
Uh-huh.
to make you look and feel better, and
Uh-huh.
that's what I do. And it's upkeep, and it's not one time and done. It's like, every 6 months, every year, different fillers, different serums that I will put on your skin to regenerate it with something called mesotherapy, which is tiny needles and a brush that does not hurt, and it allows the serums to penetrate. There's all these products and procedures.
Is that like microneedling?
Now, microneedling, they're deeper, they go into the skin. This just
Mhm.
pierces the outer dead layer, removes the outer epidermis, which has pigment in it. So your skin looks refreshed right away. And
Mhm.
then all these nutritional and regenerative serums. One of them is PDRN, which is from salmon DNA. And that's they use that often in California before they go on the red carpet. It's called a glow, and it gives them a glow for 3 days. But
I've
this
had a
this
glow.
penetrates more, and it really enhances your
Mhm.
collagen because it enhances the cells that make collagen. That's what we're
Mhm.
doing. We've learned not to burn your face, rip it, but we want to make it gently regenerate your tissues. And in fact, the fillers that I use all do that. The radius regenerates collagen. Not only does it contour and fill, it regenerates your collagen. And the other products that I inject as well are all helping your collagen directly to make better skin. You have better skin, tighter skin, more elasticity. That's what you want. You want a nice look that's not tight and pulled, but gently refreshed and hugging your face.
If I gave you four, I want four factors from you that will keep your skin um throughout your, you know, 20s to your 60s. What would you say the four factors that are most important for your skin?
Okay, so number one on the hit parade is don't smoke. Don't
Mhm.
smoke one cigarette. Each cigarette has 40 toxins, carries carbon monoxide, shrinks down every blood vessel in your body for 12 hours, each one. And in fact, when I do surgery on patients, you can't smoke for a year before. I won't work on you, and you have to stop smoking. And I get most of my patients never start again. So you want to have good skin. Blood flow is important. You shrink down the blood, it's not getting there, not getting to the tissues to generate all the good collagen and give oxygen to your tissues and to your muscles. That's number one. And also the lines and wrinkles that smokers get. Those are ingrained in your skin. Look at leather. You still see the lines. You can pull it as tight as you want. It's still there. Well, you
I
still
know you
see
can
those.
I always look at my girlfriends and I know they're on TV and they all got those little things around their lips, and
Yes. Well, that's volume loss, and we can now, there's different fillers, and we can contour that a little bit better. So that's number one. Number two is sun protection. I mean, in the olden days, they used to use baby oil and iodine and reflectors and would burn your skin off, and it's like a burn. You're burning out a layer of your skin, which is causing scar tissue underneath, and it's never going to regenerate well. And so, someone who you look at a 90-year-old's face who's been in the sun, and you look at that 90-year-old's butt that's not been in the sun, and you can see the difference in skin quality. You can see,
Mhm.
soft skin has good quality, face lined, wrinkled, from sun exposure. And so, what you need to use is a sunblock with zinc or zinc and titanium that's reflective blocks. You don't want a chemical block that's absorbed, because then the sun is absorbed and there's chemicals in it. And so they don't have those for children. Why don't they have those for children? It's not good. So you want something that reflects it. And now we have some sunblocks that are not only reflect, but they actually, when you put it on, helps to heal under the skin as well. And so all these products have revolutionized skin quality. Diet. Diet's critical. You want to have good skin, you have to eat well. You have to eat, we all know eating well. What does that mean? It means you eat vegetables with different colors on it. You have berries, you have antioxidants, all these things that will heal. You need water. Our body, a good percentage of our body is water. So you have to keep it, there you go, drinking water. So you have to keep it hydrated. Alcohol to a degree is okay, but it dehydrates your skin. So it
Mhm.
also makes it older. And so, you want to have a martini or vodka, or whatever you're drinking these days, fine. But if you have it every day and you have a few every day, you're going to get very dehydrated. So that's not good. And I think one of the keys to having good skin is a mental attitude, a positive, good mental attitude. Because if you don't, your body generates cortisol from the kidneys that also breaks down your tissues and your skin. Just like the sugar that we eat, it causes glycation, which attaches to the collagen, makes them stiffer, and you lose the elasticity. So all these things will help your skin from beginning age until ever. So if you have a 20-year-old daughter or 19 and she, I don't need sunblock, so really, when you get to be 60 and you've not used it, you're going to have old looking skin. And so you want to keep your skin, and it doesn't get better, it only gets worse. If you're a smoker, you're never getting rid of it. You might not progress and get worse, but you're going to have permanent damage. And when you do surgery under the face, facelift, or I do threads or fillers, I'm going through scar tissue, sun, pollution, all the things that I've talked about that make it worse for your skin. And so you want to keep.
Because people don't give up because I know everybody's like, Lauren, your skin's so pretty. Was I'm working on a little makeup line for older, like makeup, eyelash, eyeshadow and stuff for older women because our creases get a little like you can't wear the shimmery stuff anymore because that's really going to show your length. But we used to have a place in the Bahamas and I would just burn myself all day. That's all we did. And then at the sorority house, we did the iodine and the oil
Yep,
all
yep,
over.
there you go.
But when I turned 20, I stopped. I was like, no more sun, no more nothing. I'm just, I don't, well, it's because she was working like 5 jobs, but I quit doing it. And I raised my daughter, thankfully, that she hates the sunshine. But I see all these women in New Jersey because I live in Cape May, and all the ladies that take the tickets. I love having to pay to go on the beach that I go to the beach all year long for, and then all of a sudden I have to pay in the summer. But they
Mhm.
all got that dried skin.
Yeah, dried leather skin,
Yeah,
dried
their
leathery
cigarettes
skin.
hanging out of their mouth, and their skin's like bouncing around. And I'm like, and I know a lot of that is caused by people get addicted to the sun, especially people in abusive relationships. They need that warming factor, like a hot pad, or they need a sun. It's almost like a warmth around them. It's like a blanket that they need that emotional support. So I understand that, even though I threw some body sunscreen at the last lady I talked to. um, but I found personally for me that I use CeraVital and it makes a huge change in my skin. Do you
Mhm.
believe in that? Because it has HGH in it. Do you believe in that?
You
I
know,
do.
the our women's skin will change much more over time because of hormonal imbalances. And when you get through into the perimenopausal, the menopausal phase, the estrogen and progesterone levels are going to diminish, and that's going to affect the quality of your skin as well.
Hmm.
So anything that will improve the quality of the skin without obviously affecting for breast cancer or ovarian or anything else is fine. They've even found that now low dose birth control, where they thought it was dangerous, is actually good even when you're postmenopausal, that it really hasn't been causing any other kind of diseases. And so if you find the right product that matches your skin well, I
Hmm.
think that's perfect. There's so many products. There's a plethora of products out there for everything nowadays. But you need a basic cleanser. You need to be able to clean your skin, not harsh. We have a
Hmm.
very mild one that actually I get in a drugstore, and women all say, "Wow, this is amazing." I said, "Yeah, take the name. It's cheap, like
Hmm.
$5 for a whole bottle. Take off your makeup." because I
Mhm.
don't want to inject them unless all their makeup is off.
Mhm.
It's not
Mhm.
very sanitary. And when I
Mhm.
do other procedures that I'm having serums penetrate through, they have to take their makeup off because who wants their makeup penetrating into the skin? And so you have to have a very clean procedure when you're doing something and not be sloppy. I look at it as a surgical procedure. As a plastic surgeon, I'm more than meticulous. And everything I do has got to be that way in my office. Everything's got to be clean. Everything's got to be clean and done in the right way so that you don't have infection, you don't have a complication.
Mhm.
But serums and products that are out there, you need that. You need a sunblock. You need a good moisture cream that doesn't clog up your pores. You don't
Mhm.
want something that you're going to start getting cysts all over the place because your
Mhm.
pores are cleaned up. Sea serums are really good for your skin as well. They help your skin. You know, everyone's on retinol A. They thin your skin. And if you're out
Mhm.
in the sun, they're not the best thing for you in the world.
Mhm.
They're good if you want to use them once or twice a week with a milder dose, not a very high
Mhm.
dose. I think they're okay. But if your skin is very thin and very dry, they're probably not the optimal procedure. So we have tons of different serums and products that we can use now. You have to find someone who really knows what they're using.
Mhm. All right. We're gonna have to do part two. Do you still have time to be with me?
I have time. This is great.
Okay.
I
All
have
right,
great.
guys, I am going to close this one out and don't fear because as I close this out, I'm going to immediately we're going to do another show right after this because I know I'm getting your messages as I am on the computer over here. I'm seeing your messages come through and I'm trying to write them all down. So right now we're with Jeffrey Rosenthal, Dr. Jeffrey Rosenthal. Um, and we are going to talk some more about makeup and natural and some of the surgeries that you do have to go under the knife for. But we are with Armed Radio right now, and we want to thank him and know that this is part one. Part two will be coming out next week. Okay. So, but part one will be this week, will be today or tomorrow. Okay. All right. See y'all soon. Bye bye.
Thank you.
Let's see, stop recording, and then I'm going to